Hi, Dr. Harrison here, and today I want to talk about a very important modality that we have in our office, and that is spinal decompression. Spinal decompression is mainly used to help people avoid back surgery, so very, very crucial for those of you who have maybe a herniation in the neck or a disc herniation in the low back and you're considering back surgery or surgery has been recommended for you. I would always recommend trying spinal decompression first, because you can always have the back surgery done as a last resort. Obviously, with any surgery, there are risks associated with that. Anything from infection to even death if they're putting you under. So obviously you want to avoid that if at all possible. And obviously there's going to be time away from work or downtime where you're going to need to recover from that surgery. So those are a couple of drawbacks there. One of the great things about spinal decompression is it's an outpatient therapy. So you come in, you're on the table, and we'll talk about that in a minute as to what we're actually doing with the spinal decompression table. But you're in and out of the office in 30 to 40 minutes. So you might be on the table 20 minutes and then maybe a little therapy afterwards. But it's outpatient. Usually patients start to feel better relatively soon after we begin the therapy. So many times they're able to function and there's no downtime or recovery time needed. So another great thing about spinal decompression. So what is spinal decompression? What is it actually doing? Well, if you have a disc herniation, and if you do, you're aware of that because you're probably in quite a bit of pain, but the discs sit in between the vertebrae in your spine, and those discs serve as a shock absorber, and they're what allow you to bend and turn and twist. Obviously, if your spine were one big bone, you wouldn't be able to bend or turn or twist. So it's there to separate the bones and allow for mobility, and it also creates those gaps where the nerve roots come through so that the nerves can be distributed down the arms, down the legs, and out to organs and tissues in the body. So this is why when we have a disc herniation, many times, not only is the disc collapsing, the bones are coming closer together, and that disc may be bulging out and irritating those nerves, which is what's generating that arm pain, leg pain, numbness, tingling, all those sensations you're having. So what happens when that disc herniates is there's a pump mechanism in the disc that has been lost. What do I mean by pump mechanism? Well, the disc doesn't have its own blood supply. So as the bone above and below the disc move around, fluid is transferred in. So water, oxygen, and nutrients are transferred into the disc, and then waste products are transferred back out. So this is a constant process that's going on throughout the day called imbibition, which is just a big fancy word that means the fluids are moving in and out of that disc as we move around through that pump mechanism. But when you have a disc herniation and that disc starts to collapse, that pump mechanism has been lost. So we want to restore that pump mechanism, and the way we do that is we simulate it with the spinal decompression table. So the table is pulling and relaxing, pulling and relaxing, pulling and relaxing. It's all very computerized and very detailed according to your height, weight, and the level of your disc problem. And so the table is going to simulate that pump mechanism for you so that we can transfer water, oxygen, and nutrients back into that disc. And we do that approximately 4 days a week for about 9 weeks on average. Some people a little shorter, some people a little longer, and at that point, usually that pump mechanism will take back over and work on its own again. This works in about 90% of the patients. It's not 100% bulletproof, but neither is spinal surgery. In fact, the numbers on that are far, far lower. So I highly recommend you check out the spinal decompression. Let's avoid that neck or back surgery and get you back up on your feet. Go ahead and call the office at 407-522-5858 for a free consultation regarding your disc problem.